To be out. This is my office here in Newport Beach. What we do here is we take care of patients with underlying lung disease. Before we start down that road, I want to give an introduction about myself. I've trained at top programs in the country, including the National Institutes of Health, which makes policies and procedures for a lot of our healthcare, as well as National Jewish Medical and Research Center, now known as National Jewish Health. This is a program that is top in the country and probably known worldwide for lung and respiratory diseases. One of the things that I would like to introduce to the community here is how to teach patients to take care of themselves, to empower them to improve and prevent disease. If you have a lung disease or if you have a simple asthma problem, I would like to teach you guys to take care of yourselves, to help maintain your health and to avoid certain things that will make you worse. In addition, we also do sleep disorder here in this office, and as you know, sleep is incredibly important in your health, and a lot of us take that for granted. So one of the things that we would like to do also, one of the things we do in our practice here is we are involved in clinical research and clinical trials. What that entails is basically discovering new drugs, how to apply new drugs in treatment of patients to improve their quality of care. In the next few years, as our healthcare system, Obamacare, tries to figure out the best way to utilize the amount of money we have in our system to take care of patients. But one of the facts is that we as physicians must also be proactive in that change of our health care. How do we provide the best care with the best medicine to improve everybody's lives? Right now, a lot of the system is taken care of through governmental changes. But as patients, as physicians, we must also get involved in this. That means you guys have to stop doing supersizing, have to stop and watch what you're doing, watch what you're eating, getting involved in exercise. And as physicians, we start looking at newer and newer ways of drugs to develop to improve that healthcare system. And as the government, they try to figure out what the best policies is. And I would like to show how that interplay of patient, doctor, and the government is changing that system. There have been many, many stories of many people getting involved in that. I also started a patient support group, a nonprofit, or getting involved in nonprofit organizations to help improve the healthcare in this area, to bring more attention to diseases, more awareness to the community, and I would like to get everyone to be involved in this healthcare and healthcare changes that occur. One of the things that we are doing is creating a show to teach people how to do that, how to integrate your life with the current community and the current society in affecting healthcare changes.
Doctor, I need your help. I've been having some breathing issues, some throat issues. I'm having difficulty getting a good deep breath. I'm having difficulty. I'm losing breath really quickly, and I don't know what's going on, and it's really concerning me. I mean, all right, this is my career. My career is I'm a performer. That's what I do for a living. You know, actually, I have a production of Hamlet coming up, and that's what I use. I use my breath. I use my voice. So when I'm having some difficulty in that area, it's getting me really anxious. I don't know what to do about it. I just need some help or guidance.
So as you know, John, over the last few years, out of University of Southern California, they did several studies that show that children, in your case an adult, living near the freeway, their asthma tends to get worse because of air pollution. And that air pollution is contributing to a lot of the asthma increase that we would see normally. You remember 9/11, John? Well, in that case, if you look at asthma in New York City, before 9/11, it was only around 10 to 15%. After 9/11, with the building blowing up and all the dust floating in the air, asthma actually increased to as high as 30%. It's that pollution and the particles flying around in the air that's making it worse. In your case, because you're living near the freeway, the car exhaust is actually making things worse. And over the last few years, the California Association of the American Lung Association and the Clean Air Regional Board came up with a law that passed a couple of years ago that is actually in the process of instituting stricter rules and guidelines to help fight and reduce pollution in cities such as ours in Orange County, as well as in Los Angeles County and throughout the majority of the counties in California.
I actually am not here for myself, but I'm here for my father, who's been having a hard time sleeping at night. And my mom was telling me how hard it is for her to sleep because of how bad my dad snores. So my dad decided to take the initiative and use a sleep apnea machine that is kind of destructive in a way, or disruptive in a way where he has to hook a hose up to a box and use a certain amount of water and have this mask over his face. And then in the morning I always see him and he always has a scar or impression over his nose, and knowing how he's having a hard time with that, and he has to carry this machine with him if he goes and travels or if he's doing a road trip. And I was just curious if there's another option that he can have to have better sleep at night.
Here is evaluate patients who do not sleep well. One of the biggest problems is we're not able to recognize if we have a problem with our sleep. The typical patient that we typically see in our center is somebody who's comes in and says, "Hey, my husband snores a lot at night. He does his weird breathing at night. He snores. Then suddenly he stops snoring for a while, then he snores again." And in the afternoon, people like that and patients like that tend to feel really tired. A lot of them, if they're in stressful positions, tend to be very irritable and cranky. When they're driving in the afternoon, they feel a little bit sleepy, or they eat, they feel sleepy afterwards. Those are signs that they have sleep apnea or a sleep disorder breathing. And in our center here, what we do is we diagnose patients like that and try to treat them, whether it's through medications, through surgery, or through medical equipment known as a continuous positive pressure or CPAP machine. What that does is basically, I want to use a model here. We help them breathe and deliver more air through a mask or a nasal prong contraption like this to help them breathe better. Equipment such as this CPAP machine and mask helps you breathe better, and patients that are treated with this machine can improve as much as 1/3 of their breathing or more. And having difficulty with your sleep can affect your blood pressure, can affect your irritability, can affect your depression, can affect your ability to function at work, and a number of other issues. And treating it, whether it's through surgery, medication, or the CPAP machine, you can actually feel significantly better. And this is one thing that we would also like to show of how our clinic works in helping improving the healthcare of patients in the community.
Since you begun.